Hello and welcome to Health Econ on the Go, a podcast where we discuss everything health economics and a bit more. I'm your host, Mathilde van Kellegam, and I'm joined today by your other host, Ogun Kano. Hey Ogun, how are you doing?
Hello, Matilde. I'm doing very good. Happy to be here again. One more month, one more episode, and one more opportunity to get closer to our listeners. Thank you very much for being here. We appreciate you taking the time to listen to us. How are you, Matilde?
Very good, very good. Quite excited also to be here. And then here, spring is finally setting in, so we get a bit of sun in Europe, which is also very good for the morale. So life is going good.
Awesome.
Okay, well, to start this episode today, we'll get started with the non peer review paper. I went a bit creative this time, so it's two papers. One report from an association called Policy Q Research, and another, which is a paper from an article rather from the Vox, which is called The Impact of Global Health R&D, the high return of investing in R&D for neglected diseases. So R&D, it's research and development. And this paper was written by Dylan Matthews. Sorry, the Vox paper is called This is the World's Best Investment. A new study finds that combating malaria, TB, and HIV paid itself 405 times over. The previous name I said was the name of the report by the Policy and Q Research Organization. So I'm taking those two to then discuss it over here. So the report from the Policy Research estimate that investing in global health product R&D for poverty-related neglected disease pays off, yielding a healthy and economic return to society of $405 for every dollar inverted, which it's a lot. This report also estimates that between 2000 and 2040, at least 40.7 million lives will be saved and 2.83 billion DALIs averted, mainly in low and middle income countries. Furthermore, averting those 2.83 billion DALIs would generate $49.7 trillion in a net societal benefit. Importantly, it is to note that more than 70% of the health and economic impact is modeled to occur between now, 2024, and 2040. In the sensitivity analysis of this report, the Policy Q Research used a national income from the USA and applies it to every human being equally. In that case, they get a return of investment of over $900 compared to the $405 per dollar invested. The Policy Q Research reports reject this result as potentially unrealistic and harmful to the project credibility. However, Dylan Matthews from the Vox article suggests that because the main funders of malaria vaccine research are government and foundation in rich countries, the Global North, those groups should be valuing life equally and highly. But then the report also used another perspective, another sensitivity analysis. It's a bit of a middle ground, let's say. And in that one, they use a universal value based on average global income. So making an average of all the incomes of everyone in the world, which yields a value of statistical life of $3.48 million, when initially in the base case scenario it was $500,000. And in that case, we get a return of investment of $2,553 per dollar inverted in research and development for those neglected diseases. So it's quite a lot of money. I share this note and those two papers because I found it quite interesting to have two different views and the perspective from Dylan Matthews, where it says we should be focusing on the founder's value of life rather than the beneficiary one, which is not usually how I've seen it done in research and in papers. And I found that quite interesting and something to think about. So if you want to know more about the research I discussed there is always obviously way more to it than just the few things I mentioned. The link to the report and the Vox article are available in this episode description.
Yeah, thank you. Thank you very much, Matilde. And I guess for all of those who are listening to us, hear it again. what are the figures and then all of the estimates that this article is just suggesting. Because for me, when I read the article that you chose, this one particularly, I was shocked about the figures and the fact that these are neglected diseases. It really really it's a lot of money. Of course, when you take a look at the methods and all of that, you start to see that there is a direction to try to call for more funds, obviously. So that's part of the incentives of this article: generate evidence in terms of getting more money for these kind of projects and funding all of these activities across the normally the global south, of course, where are most of these diseases being the highest burden. Of course, I mean, we are aware of that, but that doesn't take off the thing that it's a lot of money. Again, it's a lot of money. So anyone who is interested in this topic, neglected diseases, the and the effectiveness of investing in R&D for these diseases, take a look at this article. I think it's quite interesting and quite shocking on the figures. And also what you mentioned at the end, the two perspectives, and the one that we normally don't see in articles, we tend to see it more on the side of the patients, but now it's also taking a look on the founder's point of view. It's also an interesting perspective.
Yeah, and thank you again to mention what's the goal of this report. No, I think it's always important when we read something to understand why are those the authors writing this. What's the end goal of this? And so yeah, it's clear that this report is it's calling for more fund to be put in R&D for those neglected diseases. So that's why also they went with such a high figures. And yeah, when we model, we always model. It's always a biased view of the world. So, but the numbers and the way they move around with those extreme show that it's real. We do save life. There is a need for it, and it's pretty impressive. We always think, oh, those disease, there is not much need for it, and it's not true. There is loads of money. There is loads of a big impact and a big reason to to invest in those in research for those diseases.
Very good. Now, moving on to the first article that I selected. I hope it's in everyone's interest. It's about One Health. We're going to talk about a little bit more. So, the long name of the article is Current Evidence of the Economic Value of One Health Initiative, a systematic literature review. It was published last month in the One Health Journal. So, for all of those listening to us that are not familiar yet with the One Health approach, you will be in more sooner than later. Is a term that is quite referred often in the literature. So it's a approach in the end that addresses a complex health challenges that intersect human, animal, and environmental health. This approach is particularly relevant in our interconnected world, where zoonotic diseases, those that can be transmitted from animals to humans, pose significant threats. Of course, the COVID-19 pandemic is a stark reminder of how interconnected our health systems are. From a health policy perspective, understanding the economic value of One Health initiatives is crucial. Policymakers, for example, need to very robust evidence to justify investments in these integrated approaches, especially when resources are limited and there are many competing priorities. Of course, that's the principle behind health economics, of course. In terms of findings, this review aimed to identify critically and analyze, and uh, and since it's a systematic review, also summarize the quantitative evidence of the economic value of One Health initiatives only and only if these studies included quantitative costs and benefits across at least two sectors. So keep that in mind. In is because it's One Health, we need multiple sectors, not just health. It included 97 studies, and the findings are interesting. Eight of these studies involved only two sectors, and 78, most of the studies, reported a positive economic value on the return on investment. Specifically, 28 studies demonstrated that the added value of using cross-sectoral approach, and six studies highlighted the benefits of One Health communication, collaboration, communication, and capacity building, what we call the four C's of One Health. Again, the four C's of One Health: communication, collaboration, coordination, and capacity building. Keep that in mind. The implications, I think, are significant. This review provides a strong evidence that One Health initiative can offer positive economic returns, which is crucial for advocating for more integrated health approaches. It also underscores the need for developing standardized methodologies for economic evaluations to facilitate better comparisons and more robust evidence. Policymakers, in the end, can use this information to make more informed decisions about resource allocation, ensuring that investments in One Health initiatives are more effective and efficient. Ultimately, this can lead to better health outcomes for humans, animals, and the environment, contributing to global health security and a sustainable development.
That's really interesting. And yeah, as you said, One Health is something that you're gonna come across quite a lot now in the literature and policy making process. It's a word that's being used a lot at the moment. One some areas it covers also, I think, is antibiotic resistance, as you mentioned, the zoonotic one, the climate change. So it's something that's really across almost everything we come across in our daily life, no? So quite important. Thank you for sharing this paper. So you mentioned the 4C of One Health, and why is it important to include them?
Yeah, so again, the four C's, keep that in mind: effective communication, collaboration, coordination, and capacity building. So, including them is asking the question of whether the core characteristics of One Health are generating the value that is hypothesized by many authors. With these four C's being promoted as central to the achievement of One Health impacts, it's important to determine whether it is one or more of the four C's that generate the added value of it, and if it is caused by an extension of the analysis scale and the implication consideration of this term, that is the externalities. These studies shows that most of the analysis are not investigating the added value of the integrative aspects of One Health, despite the four C's of One Health likely being applied in practice. So it's not just seeing if it is going to make an impact. I think it's obvious. If we get better at the environment, we get better at treating animal diseases that can potentially get into humans, and of course, treating human conditions are important. But what about the integration of these four elements to accomplish all of these successes?
Okay, right. Thank you. Yeah, quite quite important. If we saying that something is important, we should show that it works. No, it's a bit of that, as I understand. Okay, thank you. Well, I'll get going with the paper I selected for today's episode, which is The Cost of Influence, or Gift to Physician Shape Prescription and Drug Cost. It's a paper by Melissa Newhan and Marika Valente, which was published in the Journal of Health Economics in May 2024. I chose this paper because when I was doing my rotation in hospital for my medical training in Mexico, I was quite impressed by the presence of pharmaceutical reps, our representative, and all the gifts we got, even as student. We had breakfast, we got pens, we got myriad of tiny things that you don't really think about it. It becomes your everyday life. But then fast forward, was doing my master degree when I read a paper published in the BMG, if I remember well, and it showed that a gift with a value as low as 10 euros was influencing doctors' prescribing habits. So that was for me really a bit of a shock, and it stayed in my mind. And I think it's a paper that I tend to quote whenever I have those kind of conversations. So Ogun was not surprised at all when I chose this paper to discuss today on the podcast. Well, this study examines the influence of pharmaceutical company payment to physicians on the prescribing behavior in the USA, particularly on anti-diabetic drugs under Medicare Part D. It finds that such payment increased brand name drug prescription by 2.3% on average. Each dollar spent on payment results in a $23 rise in total diabetes drug cost. About 25% of these payments also positively affect prescription of generic drugs, often prescribed alongside brand name drugs, so it's a spillover effect. The variability in physician response is largely driven by patient insurance coverage and, to a lesser extent, by patient condition severity. To get those results, the author analyzed combined data from the Open Payment, which is a federal database on the universe of payment to physician, with physician-level data on field anti-diabetic prescription for Medicare Part D over the year 2014 to 2017. They included in total 37 characteristics about physician, their gender, their specialization, if they're a new practitioner, and so on, about their patient, the disease they have, the insurance coverage, their age, the location where they were, the education, obesity rate in the location, and the network, such as payment to nearby physician. They used to analyze it to all the data causal effect model using a residualized regression estimator and coupled with machine learning to accommodate for the flexible modeling of all the of covariates, which are often correlated. So the author conclude this paper saying that a national gift ban in the US could reduce diabetes drugs by 2%, suggesting significant taxpayer saving without harming patient care. The findings support the prohibition of such payment and highlight the potential cost benefit of policy change in physician industry relationships.
Yeah, so in terms of this paper, I have mainly two comments. Number one, I think the methods are very robust. I have to be honest, I did not review them, but they seem very complicated. So you need to develop a full afternoon to read through them. And the other one is that when you first read the results, and now that I hear you, you don't think $2 per drug for anti diabetics are that much. But when you quantify how many diabetic people there is, that's a lot of money. So I like it that they presented in terms of absolute figures. I mean, $2 instead of X percent of decrease, because this really gives you a magnitude. So a potential ban, I think, is important. So, in those terms, do we have any other evidence? How do gift bans in other countries compare to the potential benefits of a national ban in the US?
Yeah. I'll just address quickly your first comment and then go over to your question. So yeah, I think I forgot to mention they use diabetic drugs because it's something that's so common, loads of people. So a tiny change has loads of impact. When we think about that amount of money for one patient, that I think it was $23, you say, hey, what's up? Over a year? No. But when it's million and million of people, $23, they add up, they sum up. So really impressive how much that change can impact. So as for if there is experience in other countries and yeah, what was the experience if they had any benefit in other countries of national gift ban, sorry. So two examples that came to mind is in Canada, voluntary code regulating pharmaceutical promotion has been criticized quite a lot for ineffectiveness, leading to numerous complaints about code violation. Canada, largest medical regulator, has proposed stricter regulation recognizing the influence of even small gifts on prescribing behavior. In the UK, the ABPI Code of Practice and the Disclosure UK database aim to enhance transparency, but concerns about conflict of interest persist, particularly with payment to the NHS Trust, which is the National Health Services over there, and the health-related all-party parliamentary groups. A national gift ban in the US could decrease the prescription of costly brand drugs, promote the use of generics, and reduce the conflict of interest, ensuring that prescribing decisions are based on patient needs rather than financial incentive. This approach could lead to increased public trust in the healthcare system and align with efforts in other countries to mitigate the influence of pharmaceutical companies on medical practice.
Thank you. Thank you. I think this adds another layer of complexity to an already complex health system. Now that we talk about health bans, and it will be interesting to see if this can permeate to Latin America or Asian, African countries, and see how this works. Because of course, this is also happening in our country. So yeah, thank you very much for sharing this article, Matilde. So the next article that I choose, I was not expecting a lot of information from it, but I have to be that I'm pleasantly surprised by this article. You're going to see it in the link of the podcast. It's called Incentives for Plasma Donations. So why plasma donations are important? Well, these are crucial for producing not only blood per se, but also producing plasma-derived medical products and treating various serious conditions aside from the acute illnesses that really need transfusion of blood. However, there is a significant shortfall in plasma supply, particularly in the European Union, which largely depends on plasma collected outside of Europe, mainly from paid donors in the US. I was not aware of this, so point number one. This dependency poses a risk of supply disruption, especially during global health crises like, again, the COVID-19 pandemic. From a health policy perspective, understanding and optimizing incentives for plasma donation are crucial to achieve self sufficiency and ensuring a stable plasma supply. So, this article was published last month in Vox Sanguinis Journal. So, it provides a comprehensive overview of the incentives used for plasma donations across 26 countries, both within and outside Europe. The researchers analyzed data from over 490 organizations and categorized the incentives into monetary and non monetary types. Common incentives can include snacks and pre donation health checks, which I think all of us who have donated once are aware of. Again, these are provided in all investigated countries. Other incentives include loyalty programs, which are very, very interesting. I suggest the audience to read these, the loyalty programs of blood donation, small gifts, vouchers, lotteries, travel compensations, and time off from work. Interestingly, only 7 countries offer financial compensation ranging from 30 to 35 euros. So these are the smaller proportion. The study also found that countries with decentralized plasma collection model, where multiple private organizations collect plasma, tend to use more diverse incentive strategies, including both monetary and non-monetary incentives. In contrast, countries with a centralized model where only one organization collects plasma, for example, the government, usually do not offer financial compensations and rely more on non-monetary incentives. Again, snacks and the pre-checks. This suggests that centralized models may be able to leverage a more diverse array of non monetary incentives like loyalty programs, gift vouchers, etc., when financial compensation is not offered. However, a potential advantage of the centralized approach is avoiding the need for direct financial payments to donors, which some countries may prefer to do for ethical or regulatory reasons. Finally, the study, I think, highlights the importance of using a variety of incentives to encourage plasma donations, especially in countries with decentralized collection models. Policymakers, I think, can use this information to design effective incentive strategies that increase both the number of donors and the frequency of donation, what is called the retention of donors. Additionally, the findings suggest that non monetary incentives can be just as effective as monetary ones, particularly in centralized systems. This helps inform policies that aim to balance ethical considerations with the need to ensure a stable plasma supply, so which I think is important now that I'm aware that the European Union relies so much on the US.
Yeah, I didn't know about that. It's quite interesting. And well, it's a good time to say if you can go give blood. It saves life. It's always good to do. But yeah, really, really interesting paper. I was also surprised by it and all the nudging effect and all those part of public health is quite important. Behavioral economics also. I tend to not read about or look at when it's really important for the way we worked as a community, as a health system. You mentioned the financial incentive, and money always seemed like to be a big and easy motivator. Why is it not more implemented more? Or what are the issue with it that you mentioned?
I I think that's the easy solution. But according to the article, direct financial compensation, as you said, cash payments are not offered in many countries and are often regulated by law. So that's point number one. We have the legal arrays in countries that prohibit this way of incentive. Furthermore, the World Health Assembly resolution additionally urges member states to encourage voluntary, non remunerated donations, given the elevated risk of disease transmission and the potential harm to donors' health from excessive blood donations linked to paid donations. So you create a negative effects to give money people to people that may harm their own health. In addition, there is a regulatory debate in the European Union that has resulted in the recommendation that no financial incentives or endorsements should be offered to donors. However, compensation to donor from losses, cost, may be allowed. So yeah, I think you have this combination of the moral situation and also the potential harm to patients, and the more robust one, which is going to be the legal nuances of giving money to people just to donate more, with all the extra negative effects that this might create.
Okay, yeah, that's interesting, really. How to nudge people, but not nudge them so much that they can do bad to their own health by giving too much blood, no? Wow, hard.
Yeah, and I don't want to take a lot of time on this, but I think this is the thing that really surprised me. How do you balance this? Yes, I want to give you more, but not so much more that you harm yourself. So you are maintaining that balance. That's why I'm saying these loyalty programs are very interesting. They are quite, how to say it, thinking outside of the box. I will say, have not seen it in any other program. So I think it's important, and something other programs, other diseases, I mean, can learn.
Well, yeah, thank you, as always, for sharing this paper and opening your mind to that issue, to and all those ideas that are behind. No, okay, well, let's go to our last section of this podcast and the fun part. So, for this fun note, I selected a book which is called Lifelines: A Doctor's Journey in the Fight for Public Health. It's a book I read, I think, a few years ago, and it's a book by Dr. Liana Wen, an emergency physician and public health professor at George Washington. She's also a contributing columnist to the Washington Post and a CNN medical analyst. Previously, she served as a Baltimore Health Commissioner, where she led the USA, oldest continuously operating public health department. She also wrote another book, When Doctors Don't Listen: How to Avoid Misdiagnosis and Unnecessary Tests. I haven't read that book. I'm hoping to do so sooner than later. So I didn't know about Juliana Wen before reading this journey. It's her journey, so yeah, but it's a book also. So before reading a book, and after that, I was not a fan, but really impressed by her. Really like, yeah, I estimate her quite a lot. And I chose to talk about this book because it marked me. I'm not a big fan of usually reading memoirs. To be honest, I'm more of a detective murder story or young fantastic fiction kind of reader. And well, but I'm also someone that's a bit insecure about my career, its direction, and what I can do with my training. What are the different avenues? How do you put your career and your personal life? How does that work? So, getting to read and to learn about Dr. Liana Wen's professional trajectory while also understanding what was happening in her private life felt really inspiring. It really gave me some new energy to try and find my own path, not just following whatever I felt was the easiest way. Additionally, really enjoy reading her thoughts on topic on public health issues such as family planning, services, opioid use, policy brutality, protesting, and so on. With this book, you get to learn about her thoughts, but also the thought process. How did she get through that? How did you use the team? How different things were how she was feeding on everything to get to that. And finally, I leave and finish each section with one of the first sentence of the book, which is, public health saved your life today. You just don't know it.
Yeah, so again, two or three comments, maybe not to extend that much, but number one, people really, when you see a book that is written by a periodist or a journalist of someone that has to do anything with news, please read it. More times than not, they are really good. There's a book, I think it's written by Rebecca Skloot, or Skloot. I'm not really sure how to pronounce her last name. It's called The Immoral Life of Henrietta Lacks. And briefly, these books tell the story of Henrietta Lacks, whose cancer cells were taken without her knowledge and used for scientific research. So it explores these kind of ethical issues. So this just really highlights how I think these people that are not per se writers of book, but are more they tend to write shorter stories. When they get into business and write these really long books, you get to think, at least to question a lot of things that you think you were prepared to, but you are not really to. So looks like a good book. I have not read it. Thank you for sharing, and of course I will take it at look. Dr. Liana Wen, right?
Yeah. And I think she's pretty famous in the US. When I was checking on the Goodread, lots of people got to the book because they heard about her in CNN or different aspects. So they went through her for the book. I went from the book looking what was in public health. So yeah, and also the Henrietta book, I think it's a must read too. Very interesting, as you said, like when those people sit down and and write a full book, usually it's very worth the while.
Very good.
Ah.
Yeah. So thank you very much, Matilde, for sharing your thoughts and your content with us today. And as usual, thank you very much to you, our listeners. And I think we will hear together next month.
Yeah, and please comment, subscribe, leave a good review, a bad one, but a rather a good one, please. And yeah, contact us if you have a paper or anything, please get in touch. We would love to hear from you. So thank you very much for listening to today's episode, and see you back next month.
Bye bye.
Bye.